Hello everyone, today we'll be talking about right bundle branch block and its ECG changes. Coming to the basic electrophysiology, in a normal cardiac conduction, impulses usually travels down the left and right bundles with the septum activated from the left to right. So the normal conduction, what happens is from the SA node, it goes into the atrioventricular node, and from the atrioventricular node, it goes into the septum, and from septum, the depolarization usually occurs from the left side to the right side. So this is the left ventricle, this is the right ventricle. From the left side to the right side, normal depolarization occurs, and this depolarization of the septum leads us to a QF. So that's what happens initially normal. In case of a right bundle branch block, so what happens in the case of a right bundle branch block is that this conduction is to the from the AV node, his bundle forms, and then there is right and left bundle is there. So the left bundle branch is normal. The left right bundle branch is blocked in the right bundle branch block. So left side conduction is normal. Initially, there will be slow activation and depolarization of this left side of the ventricle, followed by, because of there is the right bundle branch block is there will be slow progression, slow passing of this depolarization wave from the left side to the right side. So right side depolarization will occur a little later when compared to the left front, and that's why that forms a separate QRS. So left ventricular activation via the left bundle branch occurs early, and septal depolarization, that is, you can see here by a black arrow, the left depolarization occurs earlier, and then you can see the right septal depolarization, that is yellow QRS. There is yellow arrow you can see here, and then there is a right ventricular depolarization. Thus, resultant what happens is there will be delayed R wave in the lead V1 and V3, V1 to V3, which represents the right side lead. So V1, V3 comes here, right side lead more common. So you can see here. The pattern will be this pattern. So initially, a small R will occur. Basically, this one is basically because of the left ventricular depolarization, and this second R wave is basically because of the right ventricular activation is. So this gives rise to what is called as M pattern in the right sided leads, called as V1, V2, V3, and the W pattern, reverse pattern, will be seen in the V6. The ECG changes will be QRS duration will be more than 120 milliseconds because the right bundle branch block is there. So right ventricular is depolarizing little later. So QRS, the duration of the QRS will increase. RSR pattern in V1 to V3 is called M-shaped QRS. And slightly opposite changes in the opposite leads, that is V5, V6, and there will be slurred S wave. You can see here there is a slurring of this S wave in the V5, V6 lead. Okay, so this you can see here. So this is RBBB. Generally, there is what is called as reciprocal changes, because when there is depolarization, if there are some changes, opposite changes may occur in the repolarization phase also. So there will be discordant changes, that is STT wave inversions will be seen along with that. So in prognosis of right bundle branch block in patients without significant heart disease, right bundle branch block does not have any additional risk. The patient, if it is can be a normal variant also. But if a patient is known to have some cardiovascular disease, or patient is known to have MI or heart failure, presence of right bundle branch block generally denotes that there are high chances of higher mortality. Also increases the risk of mortality as well. In healthy patient, it is quite normal, whereas in cardiovascular disease patient, if this type of pattern is there, it leads to it considered as a poor prognosis or higher risk of mortality.